I'm Mallory Safaste in Towson. It's a conversation many of us put off. Who makes decisions for you if you can't, and who inherits what you leave behind? National Estate Planning Awareness Week is a reminder to create a will, update it, or start talking about it. When it comes to estate planning, Virginia Kwiatkowski is on top of it.
We had our first will very early in our marriage.
At the time, her husband was active duty military. Then they had a child and updated it again.
In 2010, which our son was pretty much grown at that point, we went ahead and updated our will through an attorney. And that's the will that we still have.
Recently, she helped her son set up his own will through MetLife Legal Plans, a prepaid or low-cost service many employers offer.
I was able to print him an online will, him and his fiance, and then I, have versions for them now that they're married. They have to get a new one. So I think there's a lot of ways now to do this.
Virginia even brings it up with her friends.
I'll say, hey, do you guys have a will? And most of them say they do. The few that say they don't are like, we've been meaning to get around to it.
That's a common response, says attorney Alice Young with the Baltimore Estate Planning Council.
You need a will to carry out the terms of your wishes after you pass away. But the fact is, none of us gets out of here alive.
The hardest part may be deciding who should inherit your estate or care for your children.
A plan doesn't have to be perfect to be in place. And a lot of people get, especially people with young children, worry that if they don't figure out the perfect plan, it won't be good enough. And so they put it off and put it off and put it off. But in fact, a good enough plan is good enough. And while you're well and healthy, you can always change it.
How often should you be changing it?
If your assets substantially change, if your family substantially changes, or if the law substantially changes. Those are 3 triggers.
Cost can also be a barrier. Local nonprofits sometimes offer free estate planning clinics, and there are pro bono or low bono attorneys. Online services can help too, but Alice warns,
you get what you pay for. If you're doing your planning on your own, I think there is potentially a gap in the confidence that you might feel. The closer you get to it being your last estate plan, the higher degree of confidence you'll want that it's going to work when you need it to work.
And she recommends adults have 3 key documents: a healthcare directive, financial power of attorney, and a will.
The important thing is to just start asking questions. Find out what tools are available to you and what people you want to have on your team for the estate planning, and then have the conversations about what that plan should look like.
If you already have these documents, review them every 5 years. Check that you've designated beneficiaries for your life insurance and retirement accounts. And while you're having these tough conversations, consider funeral pre-planning. It saves your family from guessing and additional expenses. Mallory Safaste, WMAR 2 News. I hope you enjoyed that Matter for Mallory. To watch more Matter for Mallory stories, click the box in the corner and be sure to tap that circle and subscribe to WMAR 2 News for quick access to great content posted every day.